Hello, everybody, and welcome to this week's edition of the AHA Podcast. Got Jennifer, Alyssa, and Jacqueline here for another exciting week. So, first of all, by show of hands on the call and the audience, who is done with AHIP? All
I did mine
right.
last night, so
Yay.
I get 100.
Oh, she's
Ooh,
the
show
top
off.
scorer.
Who else got 100? I bet Jacqueline got
I
100.
got 100.
I always get
Oh,
100. Sometimes I get a 98, and then you never know what question you
I got
miss.
a
I
98
got an
and it
88.
haunts me. I'll
Yeah.
never know. I think I got the one wrong about the meal that you can have at an education event versus the you can't have a meal at a marketing event. I think I might have ticked the wrong box, but I guess I'll never know because AHIP doesn't tell me. All right, so let's start off with the big picture. Clean. I was watching the Ways and Means Committee on a couple of different House resolutions. What did you observe today in those proceedings?
Yeah, there's a couple of hearings today. The one that I know we just listened to for Ways and Means, they were marking up a few bills. There's one in there that drew a lot of conversation regarding Medicare Advantage, and that's the Improving Seniors Timely Access to Care Act of 2025. And what that sets to do is actually modify the law to adopt some more rules and regulations around prior authorization for Medicare Advantage plans to modernize it. Electronic prior authorization seemed like the way ahead for CMS as well, and also to have more transparency around decision making, reducing timelines for when things are approved. And overall, there seems to be a consensus from both sides of the aisle to help beneficiaries get care faster. And to get them access to care seems to be a very hot topic, and it seems like it really gained traction. So we're tuning into that and looking to share more updates.
Yeah, yeah. I saw 9641, 3108, 9642, 9468, 314. It was very interesting. One of them, which they voted no, they wanted the brokers to have to disclose their commissions to the beneficiary at the point of sale,
Wow.
uh, and that got shot down. So it's very interesting. I would encourage people to have a relationship with your local congressman. In this case, we're very much focused on the Ways and Means Committee, which also has a health subcommittee. And so the way that it works, which is kind of interesting, if you didn't pay attention in civics in high school, or maybe they just never told you, the House and the Senate both have to agree on the same language before it goes to the president for law. I think everybody remembers the whole conjunction junction. What's your
Mhm.
function? Schoolhouse Rock. You're not a bill. You're a law. These committees, like in the House, our advisors told us if the Ways and Means Committee votes for something, which there's about 35 people that were voting today, that the entire House will follow that vote. So they're very aligned, they're very organized. And so if it was voted no in the committee, they won't. If it was voted yes in the committee, then the House will put that forward, but then it has to go to the Senate. And then the Senate has to agree. They may modify it, which would make it go back and forth. And that's the lengthy process we go through. If you look at the math, or you just kind of Google it, AI, ChatGPT, whatever your computer of choice is, the odds are maybe 2 to 3%, right? Various years it's different, but whenever you see these HRs that are threatening and scary, just remember there's probably a 98% chance that it won't happen. So, and you can follow it through and you can impact it, right? It looks like they start these processes really early, and we can talk more about that another day. So, Alyssa, tell me anything happening hot and heavy on the agent care team.
Yeah. So this week, a couple things we've been dealing with. We talk a lot about scams and Medicare beneficiaries. It's rampant with Medicare beneficiaries. That's why CMS will sometimes reissue Medicare ID numbers to millions of beneficiaries just to help prevent and combat fraud and that HIPAA and PHI and someone's Medicare ID getting out there. But I think a lesser known thing that we talk about is scams that also target agents. And I feel like that's been kind of a hot topic this week with the agent care team. You may have seen it on social media too, but one in particular is where AI and Chat GPT and all of that has its good usage, but then it also has its bad usage where bad guys are using it to mimic a beneficiary, reaching out to an agent through email to say, hey, I'm looking for health insurance. I think most of this is happening on the ACA side. But saying, hey, I'm interested and can you help me? I need your help finding a plan. So, of course, the agent engages in this email conversation back and forth. And sometimes the fake beneficiary will have a technology issue where they can't open a link that the agent sent. So they will then send their own like calendar invite. Oh, like let's set up a Zoom meeting here, click on this to accept the invite. And if the agent does it, it could be a malicious virus. It's all a scammer pretending to be a beneficiary, or pretending to be somebody interested in insurance. So we had that happen this week.
So let me get this straight. There was an agent, a broker, community-based broker, and they basically were scammed by some phishing or for some malware by probably an AI, generated entity pretending to be a beneficiary so that they would click on the link and there was some back and forth. The kind of the equivalent of send me some money in this other country. I've just come into a problem, right?
That's right. Yes,
Wow.
that we receive, some of them are really obvious, like, "Oh, your long lost uncle," or somebody needs an heir to their fortune and I found you. So some of those are like obvious, right? And we
It's
know
a
to look
new
out for
version of
those.
that though.
It's a new version of that, and I think, as AI and ChatGPT and all those get smarter and sound more conversational, I think it's easier for an agent to fall victim to somebody saying, "Hey," they could mimic a beneficiary saying, "Hey, I got this bill and there's a PDF attachment." Or, "Hey, I wanna set up an appointment with you. Click here to, let's get on Zoom." And it could be something bad, and so we had an agency who had gotten hacked by something similar to this type of scam. And of course, we realized it because we received a weird email from this agency. It just kind of came out of the blue, and the topic was it was odd. It was just unexpected, and so we were able to help that agency, um, kind of troubleshoot on their computer to help them kind of wipe that out, run some scans, clear it out, and get it back up and running. And I think in some cases, agents don't even know they might have this. Um, so, it just highlights the importance of being really vigilant in your email when anything seems suspicious. Everything that you would recommend a beneficiary do, like be alert, be vigilant. If you're not expecting something, maybe don't click on the link or don't open the attachment until you contact the person and make sure it's actually legitimate.
Yeah. Yeah, the attacks are definitely gonna continue to get more sophisticated, and you're right, there's 2 sides to it because they said that some of the, new AI has, identified vulnerabilities, in the
Mhm.
prominent software and hundreds of vulnerabilities, so they're working through that now. I follow the financial world a lot, and I know that there are real, malicious, holdups, so they're locking people down in cyberspace, and they're making them pay money to get out of jail. That's
Mhm.
like a real thing.
Yeah.
And then also from the investment community, they're like cybersecurity is going to be big. So there's a lot of big investors that are, looking at the software and the security of the software. So that's good. That's a great benefit we provide though with the technology capability we have at Advocate. It's really great. We were able to support an agent and an agency in that challenge. Thank you, Alyssa. Jacqueline, how about the client care team? What is on your mind there?
Yeah, absolutely. Well, first of all, we are about to publish our annual notice of change book of business communications catalog, and there's a really great flyer in there for Medicare fraud prevention too, and how beneficiaries can protect themselves and their information. And it usually comes down to three pieces of data that if you just safeguard, you'll really do a great job preventing, fraud and, things from happening. And that includes your Medicare ID number, treat it like a credit card, like your social security number. Also your social security number and your banking information. Those are very protected pieces of information that you should not be sharing or feel pressured to share, especially over the phone to somebody that you've never spoken with before or that called you unsolicited. Medicare and Social Security don't get in the habit of calling you out of the blue and asking for that information. So when in doubt, don't provide it. Is a recommendation there. And then for the client care team too, one of the things that that we come across of is, speaking of access earlier, we help folks access things like durable medical equipment all the time. Recently, we helped a MA member access portable oxygen, and one of the things that she actually called in about was letting us know that for some reason it wasn't approved, like her request from her pulmonologist, and approved a portable oxygen device, and they knew that she needed it. And so we actually looked up, and talked to the health plan about what was missing in that documentation. And in that case, there was a 6-minute walk that that member needed to do to demonstrate that her oxygen levels were below the necessary threshold when she moves for a certain amount of time. And a lot of that good information is actually set by Medicare, CMS. They have a national coverage determination information sheet that's really helpful. So the client care team often reads those policies and guidelines to help providers to know maybe what's missing from this. There's certain clinical criteria or things that members need to demonstrate in order to access this stuff. So we were able to help the member, and she now has it and uses it daily. So that's awesome, and that's just an example, that we see often there.
Well, that's exciting. I have a question for you, Jacqueline. I've often wondered about this. The previous Surgeon General had a big campaign about high blood pressure, the
Mm.
silent killer kind of a thing. And so when he was changed, the campaign didn't go. But how would we go about ordering a blood pressure cuff for somebody? Because I thought, in the plan benefits, they usually have medical devices like a blood pressure cuff. So what would be involved in that? Because I thought that you could work with the primary care doctor or with the individual and people that are at risk, we could just help them order it kinda automatically as a follow-up to the enrollment.
Yeah, there's a couple of things there. I would say number one, the best way to check your blood pressure is to be a compliant patient and do your annual wellness visit and go to the doctor and to make sure you control it because it is a silent killer. And sadly, a lot of people have events because it's uncontrolled, and that's why it's been in the star ratings measure for a long time is controlling blood pressure. Oftentimes too, I know in a lot of some of the plans that offer over-the-counter products, it depends on the plan. They have historically included a blood pressure, a cuff where you can order it and keep track of it at your home. But yeah, being informed of your health and keeping that under control is important. Also, staying compliant and taking your prescribed medications is also a terrific way to control your blood pressure. So all of those combined definitely help.
That's a good point because that really the authority there is the primary care doctor, and so, but if you're active in your own health and you're, let's say, a new Medicare beneficiary and let's just hypothetically say you turn 65, you got on a plan, say here in Florida, would they be able to just go out on their own and get that, or would they have to have the doctor's approval or recommendation based on what you said CMS has laid out for the requirements?
Yeah, so to my understanding, you can actually buy a blood pressure cuff like over the counter. It's pretty accessible and a lot of plans were, supplementing the costs of that so that beneficiaries could, not worry about the cost of purchasing one. It's a
Yeah,
common
so if
item.
you
Yeah.
are if you are active in your own health, you could do that if it's included at no additional cost. Not that you shouldn't reach into your own pocket from time to time to be active in your health, or if you find from your primary care doctor during your annual wellness visit, which we encourage everybody to do, you might want to manage it yourself and just make sure how you're doing and get one. So that would be cool. Thank you, Jacqueline. Thank you, Alyssa. So Jennifer, you got any travel plans coming up? I think the carrier rollouts are starting to happen.
Yes, I do. I think we all do. This is the time of the year with a lot of travel. So I know all of the agents who are listening out there are anxious to know what the carriers are going to come out with their plans. They're being very quiet about it, but this is the time of the year where they'll invite out all of the FMOs to come to their summits and their rollouts to kind of hear overall what the carriers are looking to do. So the last couple days was the Health Spring Summit, which we had Wendell on our team attend, and he'll be coming and giving us some information that we'll be pushing out to all of our agents and agencies. And then next week, we'll be, all of us, I think, here on this podcast will be attending the Aetna Summit. So we're excited to do that. The other two big carriers, there's a lot of smaller regional summits that go on, but there's also the two big carriers we're probably all anxious to know about, which is United and Humana. And their rollout summits will be happening the second week of August. And we'll also have folks in attendance there. So if you're listening to this and you work with us, we'll be sending that information out. And also on our, we put all of that information out on our Advocate for Agents website too. So you could go out and look at the latest and greatest information. Or just, we love to talk to you. We love to hear from you. So if you just want to call into our agent care team, we'd be happy to give you any juicy nuggets that we can tell you and what we're hearing. So, but I
I
think
want to
we're
say
going
one
to,
thing too,
yeah, go
Jen,
ahead.
to reiterate that. Go to those carrier meetings that are local, right? We always say that.
Yeah, I agree. Yeah.
And
So
then, Jacqueline, I think we have some meetings in addition to that, 3 or 4 different organizations. Give me a couple highlights of that. Who are we supporting and working with?
Yeah, absolutely. So that same time, we'll be meeting with MedPAC, which is a congressional advisory body for Medicare to Congress. So they're a really great group to interact with and to especially on this subject of agents and brokers. We're looking forward there. We're also an ally for Better Medicare Alliance, BMA, and they put out a lot of great work. We look forward to interacting with them. And also organizations like CMS will be coming across a couple of people from their leadership to next week. So it'll be a jam-packed week.
what do you
Well,
guys
no,
like to
we
tell them when you go out there? I mean, what's this? I mean, agents want to know that, right? They're always looking to know that we've got their back. So what are some of the things that you guys share when you go meet in front of those people? I know, Darwin, you
I
and
can take
Jacqueline. Yeah.
I can take that one. But Jacqueline, also NAFA. Well, we're having the working group, right? Aren't we giving a
Yep.
presentation on
Uh,
Tuesday?
yep. The registration link is now open, and we're going to have a LinkedIn post about this as well. Darwin will be speaking on that too and sharing some of the good work that we're doing there with CMS, a little bit on AI too. So that's next Tuesday, the 21st at noon p.m. Eastern time. You have to register.
Yeah, and then also the MedPAC advises CMS as well. They're officially the Congressional Advisory Group. There's a lot of new folks and chairmen, and so working. At this point now, Jennifer, thank you for that question. Now we are now working actively, both individually as me or as advocate, and through, in many cases, the Medicare Collective. But one way or another, and often many ways, we're talking to both the CMS policymakers at various levels, the career folks that have been doing the work and provide continuity, as well as the political appointees. We now have working relationships with all the healthcare oversight committees, so the House and the Senate, and Ways and Means in the House, and Energy and Commerce. So there's multiple entities in the House and Senate that have purview over that. And of course, our senator here, Rick Scott, is involved in the aging, and there's a lot of different tangential organizations that impact that. And then, so those oversight committees, the policymakers themselves, and then the governing bodies like MedPAC. And the messages are pretty consistent. It's number one, that the community based brokers are a safety net and they add a tremendous amount of value at great economics, right? They're terrific in help information flow and help resolve, gaps and barriers and really just the healthcare that was intended to make it work that way. And then, we show the quality FMOs, right? A quality broker and a quality FMO work together for the betterment of the beneficiary and a safety net. And they prevent a lot of stuff. And so establishing the 5 quality metrics, they're lagging indicators of quality, but you get out of the need to make all these crazy different rules because there are a few bad actors. Every industry has bad actors. But what we're trying to say is you don't have to make more and more rules because the bad actors are already circumventing the rules that are there. But what you need is you need a yardstick across carriers to know a bad actor when you see one, regardless whether it's a call center or this or that or the other thing. And those 5, of course, just to be thorough, are the accretion rate. You really want accretion rate to be north of 90%, 95% for us. The rapid disenrollment rate, you really want them to be low, maybe 5% out of the enrollment you submit, as opposed to 20 and 30%, which we see in the worst case scenario. Your annual retention should be up around 85%. We've seen it below 70% for the bad actors or just problematic. They're not always nefarious. Sometimes it's a variety of things. But then the complaints to plan, which are kind of hard to aggregate, and complaints to Medicare, which are very broadly defined, and that we think they should refine that terminology a little bit because it's not a complaint if someone's calling to ask a question. But when you take the 5 in the totality and you look at the low and the high, that's a great way to look a little bit deeper about where the good and the bad things are coming from. So thanks for asking that, Jennifer. And that work. Last thing I'd say on that is that it's important that each carrier uses those same 5 and they define them the same way and they, measure it by plan. A decent plan in Florida would look different than a PPO plan in Texas. So we want to kind of measure it by the plan type and maybe the geography as well. But we wouldn't want to put somebody's career at risk or put them in the doghouse because it wasn't a good measuring system. Speaking of that, Jennifer, and the move towards quality, anything on Humana? Did they turn on their call center? I know they said in April they were going to look at it. I know we talked about it last week, but curious if you heard anything and what you're seeing there. I think we also talked about GoHealth being delisted and some of their financial pressures.
Yeah, the pressure's still on with the call center model, and I think that speaks a lot to the carriers looking for quality over quantity, right? And to your point, we really want to see the industry elevate as a whole, no matter who you're working with, if you're an agent or whatever FMO, like we all just have to do the best possible job that we can. And that really comes down to doing a proper needs analysis. You always say that retention starts at the sale. So I think that's where it's at. And for that reason, we're seeing a lot of the carriers and plans, uh, sort of downsize or terminate, get rid of whatever you want to say their call center, their call centers that are not performing well. And Humana is not allowing any of the agents that had once been contracted at any time to get recontracted at this point. And if hopefully we'll see them open that up because I know there are some probably really great agents out there that are unable to get contracted with Humana right now. They're aware of that. They're really just trying to stabilize. They don't want to see, the agents that were in that sort of call center model to come and appear over on the field and still do things over the phone, right? So we got to make sure that we're all just doing the right thing together. And I think it comes down to it needs analysis. So it'll be fun.
Yeah,
It'll be all right.
you reminded me of one of the questions, Alyssa. Whose job is compliance?
Yeah.
Yeah, it was
It's
an agent
everybody's
question.
job.
Everyone.
It's
Yeah.
everybody's job. Absolutely.
Everyone. I
It's a
I really hate that they
responsibility.
put that compliance module at the end when I thought I was done, and they sneak it in there after fraud, waste, and
Yeah,
abuse.
you think you're done after the final exam, but you're not.
But, you've seen it, Alyssa. You've seen the problems that come with it, and, what would you say as it relates to compliance? Because sometimes I think compliance and quality go together. I mean, they do go together, but sometimes I think people look at it as an impediment. So, how do you see the best interest of the beneficiary being met when it comes to compliance? Is it a blessing or a curse or maybe both?
I think it can be both. And when we do Advocate Health University sessions on a compliance topic, I always say, compliance and Medicare go hand in hand, obviously. And while some agents may have like a view of compliance as sort of like out to get you, I always say we try to turn that around and say we're there to protect you. The compliance is there to protect you. I'm here to protect our agents. Like our compliance email box, if you email us, you're going to get a quick response. And our whole goal is to keep you out of trouble, keep advocate, keep the beneficiary happy and get them on the right plan. So, if you want to retain a book of business, if you want to grow a book of business, you have to do it compliantly. You have to be compliant. You can't cut corners. And that's what we're all about. Carriers do sometimes give us information. Darwin, to your point about product type, they'll show us, like one carrier in particular I can think of shows us a chart. So they compare Advocate as an FMO to themselves as a carrier. And it'll be like a pie chart, and it'll show this many was HMO, this many complaints was PPO, this many complaints was DSNP, which is good. And I think as we get into 2027 and we see more chronic condition plans coming out, I think that's going to be a big hot plan type for 2027 is getting into those chronic condition plans, because I think we're going to see more expansion of those. And it's important that agents have a good understanding of those, so that they sell them compliantly, so that they can educate their beneficiary about them, so the beneficiary gets the most out of them. Because I think, that's going to be an area of focus is chronic
Yeah.
plans.
Well, and we got 15 more drugs coming next year too, right?
Hmm.
They did 10 this year and 15 more next year. So that's going to put more pressure on the plans, right? Especially the chronic condition folks, if they're on a
Hmm.
lot of highly expensive drugs, that may give them some relief. Now the carrier also has the burden to finance that. So if you want to smooth out your payments, the carrier has to be a bank now and give you a little credit,
Hmm.
which is going to cut into their costs, right? So on one hand, the government's pressuring them in terms of the laws, right, making things more transparent. Supposedly, they're going to have to report all their medical loss ratios, and there seems to be some bipartisan support. That was the only one that sailed through Ways and Means that I saw today, uh, unanimously. And so, you expect those pressures continue on the carrier, and then the carrier is going to have to find those efficiencies somewhere, right? And so the opportunity is for us to work more closely. But the reason I designed those 5 quality metrics is that you can follow the quality metrics to the financials. And so the financials for the carrier, as they look more closely, are better impacted when you're really good at accretion and quality and good retention and compliance. And then their impacts, they lose money when you're pegged on the lower end. And as they connect the dots better to not just enrollments, but what happens after the enrollment, I think that's where you're going to see things happen. Jennifer, have you seen the financial engineering continue? Because one thing I've seen is that, as the call centers move into, different models and different lines, and I see a lot of private equity money coming in. And even before it was private equity money, I saw a lot of people that just do a land grab. They financially engineer, they give people incentives to come in their hierarchy that are pretty much cash related, and they're not creating any value, but they seem to be cobbling together these networks. Are you still seeing that trend continue?
Yes, I am. Well, after 21 years of, or 21 AEPs, nothing ceases to amaze me that comes in. There's always something going on. We have FMOs popping up everywhere. You have some that have sort of like maybe sold out and checked out. So they kind of go out. So it's always a new set of competitors, I feel like. I think that, when there's what's this famous saying, in the absence of value, people throw out money, right? So
Cost, yeah.
it's a
People
way
shop
to
price.
that's not what the industry needs as a whole. What we need is we need to add lots of support and service to help agents. The agent role is to get paid the CMS commission and to grow a book of business. And the role of the FMO and the agencies and the GAs and is to provide oversight and training to agents. And not only that, it's to offload some of the burden from the carrier. So there's a role to be played in those different spaces. And so, yeah, what I do see sometimes, I hear it all the time, and they fly under the covers. But you got, somebody that has a big override agreement and they're trying to pay one single agent more than the street rate. And that's just not what the way that this business works. It's not um, allowed to do that, and I'm 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 proud that we've got documentation and information and things that we do from our compliance to make sure that we're doing things the way they should be done. But there are people out there that aren't. At the end of the day, it all comes out in the wash. I feel like, time tells all tales.
Yeah. Well, and it's a virtuous cycle, right? So a lot of the industry does focus on negative, and there are a few bad actors out there. But I'll end on this. I'll give you guys all one more comment, but it's a virtuous cycle, and when the carrier makes a better benefit structure and has high quality and gets the 5-star rating, they're allowed to promote that year round. And when the agent works more closely with a quality FMO and broker, that helps them impact their star ratings, but more importantly, it helps beneficiaries experience the system the way they should, because we're in the prevention business. And if they're active in their health and are active in the benefits of the plan, and the plan can give them more benefits and we can facilitate that, that's an upward spiral. And then the following year, the carrier, who can only make so much profit, right? 3, 4% maybe, then they can put more benefits into the plan and continue to innovate and continue to create value. And that's really where it's at, right? It's in the productivity, it's in the increased gains, it's in the innovations that we have. Final comments here. We're running a little bit out of time. Alyssa, Jennifer, and then Jacqueline. I'll give it back to you. Alyssa.
My final comment would just be, if you've been putting off your certifications, don't put it off. Go ahead and jump on those and take them one carrier at a time. That's my piece of advice to agents. And if you've been doing this a long time, you know how difficult it can be to kind of track a bunch of carrier certifications and where you are with each of them. So I tell agents, focus on one, then move on to the next, then move on to the next. But jump on those. And as you get those invitations from the carriers to attend those local rollout meetings, I encourage you to go. You might think like you have everything from the certification or you can research the plans on your own, but going to those is so valuable, puts you in front of the carrier reps. It gives you more information. Attend those. If you need dates, check with
The
us. We got them.
the pace only quickens from here.
That's right.
Jennifer.
My comment would just be that, we're heading into another AEP that will probably have some disruption. We will see some planned exits from carriers based on the area that you live. Uh, don't worry. This is also it's sunshine, right? Because this means there's opportunity out there to help a lot of seniors pick a new plan. So let's put a good positive mindset going into this. Get, like Alyssa said, get your certifications done and be ready to help a lot of beneficiaries, and the money will follow.
Yeah, that's good. The sky is not falling; it's just cloudy. But sometimes a little rain is good for you.
Yeah.
Jacqueline.
Yeah, so I'm full ANOC swing right now. So we are preparing our communications out to our regional managers. We're going to communicate to agents too. And I think agents are going to find a lot of value in a lot of the pieces that we have. And so take a look at that. We'll be sharing that soon, and get ready for retention work, because if you're not talking to your clients, somebody else is.
Ooh, good one.
Yeah. Yeah, retention starts at the sale. So definitely stay close. Well, thanks everybody. It's going to be a crazy AEP, but we're ready for it. And this is what we train for. So have another nice week. And I appreciate you listening for another week of Ha Podcast.
Thank
Bye,
you.
guys.